certainly from some of my organisations over here, whether they're involved with disability or particularly vision care, that certainly for people with low vision or no vision, a lot of them are sheltering, or they don't feel confident to go out. And of course, with the new measures, and I don't know what it's like in your areas of the world, but of course there's lots of different measures that are in place for going into shops or just going anywhere. And they don't feel comfortable or confident about going out necessarily. So, you know, I think there's going to be a lot of people who are still isolating right now, or don't necessarily need to isolate, but they are just not confident to be able to come out. And if you don't have any sight, then it's, you know, I worry that they're going to become lost in the system completely. And if we don't get to see them, if people aren't aware of them, that they will go behind closed doors and not come out again.
One of the things it will be surely the isolation, the increasing isolation that will be for people with disabilities, even after the social distancing has been removed, etc. But the other impact is increasing in poverty, because some, although they have some disability, some they still do some kind of business, selling in the market or whatever things they do to earn some money, but now they can't do it because they're not confident enough to go out their homes and go to fetch for food for themselves. So I think the increase of poverty is one of them. So these people will need more support from us, from the NGOs working in the areas of, I would say, social responsibility, etc., to support them. This will be one of them. The other one, I would say, probably increase of disease among people with disabilities, because if they don't, even now, if they are not having enough health care that they will need, it means by the end of this period, they might be worse, or their condition, if they have any treatable condition, might get worse. And when they go to the hospital, it might be a little bit later to cure that or not. We did a study last year, for example, it was a RAP, and it showed that for people with disability, the access to eye health, it's more difficult than people with not disability. And if they are poor, or the poorer they are, their access is even worse. So which means, I think now is the same situation, but not only for eye health, but for the health in general. So if we look at that, they have disabilities, they are becoming even more poor than they were before, so their access to health will be even less, and they'll probably have more health problem than they were supposed to have.